Now there's a lot to do.
That she's lying with her back on the left and her feet over on this side and her head down.
Well, about 33 centimeters now. You're at 35 weeks and 33.
This is what the baby's heartbeat sounds like. Yeah.
To help you through the next 9 months, you will be going to a doctor, nurse midwife, or clinic on a regular basis.
We're going to do a few things before you get in to see the doctor. We're going to do your weight, blood pressure, and do a little urine dipstick test. If you'll just
During each prenatal visit, you will be given a physical exam, be weighed, have your blood pressure taken, and have blood and urine tests.
Diane Rudolphi. Hi, David Dagan.
Hi, nice to see you.
You will also meet to talk with your caregiver.
Welcome. How are you feeling today?
I'm feeling pretty well today.
Good.
Thanks.
Let me take a look at what you wrote down in the history here to see if I have any questions. Who in the family had high blood pressure?
My grandmother.
The relationship with your caregiver is important. Work together. Speak freely about any concerns or problems you may have.
Also along the way, if you have any other questions, we'll give you time to make sure you ask all the questions you have now. The ones that you don't remember now and you wish to ask later on, again, save them up, write them down. Please bring them in and ask.
It's a little bit early to be able to
Listen to your caregiver when he or she discusses what you should be aware of, what you should do, and what to avoid during your pregnancy.
We'll try to make sure that the baby's head first.
It seems like when I eat regular meals or eat pretty much all day long, I feel a little bit better.
Good nutrition is especially important when you're pregnant.
And at that point, you should be eating at least 3 meals a day. A fourth meal is fine, or more now, certainly. Try to eat something from each of the major food groups every day. Try to drink at least 2 quarts of liquid every day.
Your daily diet should include servings from each of the 4 food groups. They are protein, which includes meat, fish, poultry, and eggs. Dairy products, such as milk, yogurt, and cheese. Vegetables and fruit. And grains, including bread, rice, pasta, and cereal. But stay away from junk foods like potato chips, candy, cakes, and pies, which are high in calories but provide little nutrition.
Why am I getting fat?
Well, you're supposed to. One of the things that happens during the pregnancy is that you put on weight so that you can help protect the baby. And in fact, we know that women who start out the pregnancy at pretty much a normal weight like you did do best if their total weight gain is between 25 and 40 pounds, somewhere in that range.
Hand in hand with good prenatal nutrition is moderate physical exercise. It will help build your strength for the hard work of pregnancy, labor, and delivery, and may help speed your recovery.
Exercise is reasonable to do while you're pregnant. If you're active now, if you do aerobics now, if you walk or jog now, we consider that certainly a reasonable thing to continue to do. I don't think it's the time to go out and decide to get into shape and start a vigorous exercise program, but a moderate amount of exercise early on in the pregnancy is certainly acceptable as long as everything seems to be going well. In general, I would recommend doing low impact or no impact types of sports such as walking, swimming, riding the bike or stationary bike primarily, those kinds of activities that you may normally do, and doing them to a level of comfort.
You should also avoid contact sports and those with a risk of falling or hitting your abdomen. When exercising, drink plenty of fluids. If you haven't been exercising and you'd like to begin, start slowly. Begin a walking program or join a prenatal exercise class. Ask your healthcare provider about specific exercises that will help strengthen the muscles of your back, legs, and abdomen. These are the muscles you'll use most during delivery.
One of the things we ought to talk, if we're going to talk about physical activity, we ought to talk about sexual activity too. Sex during pregnancy is fine as long as it's comfortable for you. If anything hurts, don't do it. If you have any bleeding or you have any leakage of fluid from the vagina, don't have intercourse, and in fact let us know about it right away, because that can be a warning sign of a problem during the pregnancy.
While you can continue most normal activities throughout your pregnancy, you should take some precautions for the safety of you and your baby.
Do you drink?
No,
Do you smoke?
I used to.
Okay, and you've stopped recently?
This morning.
This morning. Best time to stop. Anytime is a good time.
I made my mind up. That was the last one.
Smoking during pregnancy reduces the flow of oxygen and nutrients to the fetus, which can cause serious problems such as an increased risk of miscarriage, premature delivery, and low birth weight. But if you quit smoking now, you'll reduce your baby's risk of complications. Alcohol. How much is safe to drink while you're pregnant? No one knows for sure. Heavy drinking can cause severe mental and physical defects in your baby. And as for the effect of an occasional glass of wine or beer, you're better off playing it safe and not drinking at all. In addition to being illegal, drugs such as cocaine, crack, marijuana, heroin, and amphetamines can cause serious problems for your pregnancy and serious birth defects in your baby. You should also avoid taking any over-the-counter medications or prescription drugs without first checking with your healthcare provider. If you have a cold, get plenty of rest, drink fluids, and use a humidifier. But if your temperature rises above 100 degrees, call your healthcare provider, because a high fever can be dangerous for your baby. You should also take steps to prevent yourself from getting a disease called toxoplasmosis. While rare, it can cause serious birth defects. It's transmitted through cat feces and through raw meat. So if you have a cat, have someone else handle the cleaning. And be sure to cook all meat thoroughly. Another safety precaution you should take is to wear seat belts at all times. A lap belt with a shoulder harness is safest. During your pregnancy, you will experience many changes, many new sensations. Most of these are normal. However, you should talk to your caregiver about anything that concerns you. And make sure you know the signs of preterm labor. Going into labor too soon is a serious problem, but it can be treated if detected early
The
enough.
same kind of contraction that you get with premature labor. They don't have to be painful to put you into premature labor. And what's important is not how strong or whether they're painful, that it's the pattern that they're occurring in, how frequently you're feeling them.
Preterm labor and other problems usually have warning signs. These include contractions that occur more than 3 times in an hour, severe or rhythmic cramps or abdominal pain, change in vaginal discharge, moderate or severe vaginal bleeding, persistent nausea or vomiting, burning or painful urination, sudden swelling of the hands or face, headaches or blurred vision, decreased fetal movement. If you experience any of these warning signs, contact your caregiver promptly.
How about childbirth classes? Have you been going to childbirth classes?
Yes, actually we have.
And how are they going?
Real fine. Good information. We're at the part now with the breathing, actually for labor and everything, so that's rather interesting.
Childbirth classes are an important part of your prenatal care. They provide information that will be helpful throughout your pregnancy, as well as teach you relaxation and breathing techniques to help you through labor and delivery. Good prenatal care means good nutrition, exercise, avoiding dangerous substances, taking safety precautions, and seeing your caregiver on a regular basis. Taking these steps can improve your chances of having a healthy pregnancy and a healthy baby. And that's the best reason in the world to start right now.